Good afternoon and welcome to the COVID-19 special edition on Channels Television. I'm Millicent Walker. It's a 30-minute daily update at noon at 6 p.m. and a 45-minute update at 9 p.m. on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights today. Nigeria COVID-19 cases now 65 as Lagos State sees a surge and Bauchi State witnesses its second case. President Muhammadu Buhari orders the immediate release of 15 billion naira to Lagos State government and Nigeria Center for Disease Control (NCDC). And South Africa records 2 deaths as US overtakes China and Italy in the number of COVID-19 cases, according to the Johns Hopkins statistics. Now, the number of COVID-19 cases in Nigeria is rising by the day. Latest information from the Nigeria Center for Disease Control (NCDC) puts the figures at 65. There are 14 new cases made up of 12 in Lagos, 1 in the Federal Capital Territory and 1 in Bauchi State. The NCDC further says that of the 14 latest cases, 6 of the new cases were detected on a vessel. 3 are returning travelers into the country, while 2 are close contacts of confirmed cases. A breakdown of the confirmed cases showed that Lagos now has 44, the FCT 11, Ogun State 3, Bauchi 2, Ekiti, Oyo, Edo, Rivers and Osun have 1 case each. Out of the total 65 cases, 61 are described by the NCDC as active, 3 cases discharged and 1 death recorded. Well, the Nigerian government is taking no chance at all in the war against coronavirus. On his verified Twitter handle, Nigeria's president ordered the release of 10 billion naira grants to the Lagos State government, which he says remains the epicenter of the COVID-19 outbreak in Nigeria. The president hopes the grant will enable Lagos increase its capacity to control and contain the outbreak, while also supporting other states. He also ordered the immediate release of a 5 billion naira special intervention fund to the Nigeria Center for Disease Control (NCDC) to equip, expand, provide personnel to its facilities and laboratories across the country. According to the president, the Nigerian Air Force is already making its fleet available to the Presidential Task Force on COVID-19 to enable a better coordinated and more effective response across the country. He has also directed that only cargo vessels that have been at sea for more than 14 days be allowed to dock in our ports after the crew have been tested and confirmed disease-free by the port health authorities. Now, this 14-day restriction, according to him, however, does not apply to vessels carrying oil and gas products, as by their nature, there's minimal human contact. He has also suspended the movement of commuter trains to limit the spread of the virus to other parts of the country, directing the NCDC to draft all its recent retirees back into service to beef up on manpower as the nation responds to the pandemic. And according to Nigeria's president, the Nigerian Air Force are conducting an evacuation mission to bring back some of the Nigeria specialists in Central Africa to enable them support the national response. Let's go over to our studios where our correspondent Friday Okegwe joins us for more. Hello, Friday. How's Abuja today? The state has recorded another case to the numbers already. How are they doing?
Thank you, Millicent, and welcome to Abuja. These are the latest developments from the nation's capital city, Abuja. As we speak, the total confirmed number of cases as at the last update by the Nigeria Center of Disease Control is 11. This means an additional 1 case from the 10 that was reported about the same time yesterday when the Minister of Health did his press briefing here at the nation's capital, Abuja. 10 out of the 11 cases in Abuja are active. 1 fatality has also been recorded, which of course is the only death so far in the country. That record is from the nation's capital, Abuja. And none of the patients here has been discharged from the hospital so far, even though the Minister of Health at that press briefing yesterday insists that all the patients in Abuja are in stable condition.
Now, Friday, when we spoke to Kayla McGrath, correspondent with you there as well yesterday, she mentioned the low level of compliance according to the measures the FCT had taken. What's the situation now?
Well, as to the level of compliance to that instruction to stay at home, we can actually look at it from two angles. On the side of those who are working, there is a high level of compliance because on the streets you see only few people, and those are those workers who are rendering essential services. Remember that instruction did say that workers who are rendering essential services can actually go to work. So the level of compliance on that regard, is actually high. But on the second side of it, in the market, those who are selling, even though they are not selling essential commodities, the level of compliance is actually not very high because we still see some shops that are open, some people who are doing shopping in the market are also in the market buying commodities. And the issue of social distance is another issue when it comes to the market because a lot of people who are in the market, both the buyers and the sellers, not many of them are actually paying attention to the social distancing recommendation of 3 meters from each other.
All right, thank you so much, Friday Kirebe. We'll probably connect with you a little later to get more from the Federal Capital Territory. Back in Lagos, the State House of Assembly has passed into law an emergency bill to help the state combat the coronavirus pandemic. It's sponsored by the Speaker, Mr. Mudashiru Obasa. The Emergency Coronavirus Pandemic Bill 2020, that's what it's being called. And it affords the state governor, Mr. Babajide Sanwo-Olu, the legislative latitude to spend an initial sum of 20 billion naira to effectively contain the virus and also enforce compliance by Lagosians. Now, that should interest you. The law also empowers the governor to declare a state of emergency of up to 3 months if the situation so demands, making recourse to the Assembly before any regulation on the pandemic and providing a window for the establishment of the Coronavirus Trust Fund. In addition, the law also stipulates a fine of 100,000 naira for defaulters, 1 month imprisonment in the correctional center, or 3 months of community service. Well, let's get more updates with regards to Lagos. And our correspondent, Ini John Mekwa, was earlier around Ikeja and now has this latest.
Here at Computer Village area of Ikeja in Lagos State, it's a shadow of itself. Normally, this is a densely populated area, especially on weekdays, because a lot of people go through this area to go to work. There are a lot of businesses around here. Just not far away from here, you have the industrial area. A lot of industries and companies are there. There are banks around here. So normally, traffic here is normally very, very tight. But at this time, the road is almost empty compared to its normal situation. The buses here, talking about the transport, the public transport system, the buses here are running, well, less than the 60% that Lagos State ordered the bus operators to run at. Well, I can tell you they are not doing this because they want to. They're doing it because a lot of people are at home, and so they don't have a lot of passengers. A lot of them are angry about that. And then, of course, the shops here, most of them are normally shops that deal in clothes, in shoes, in gadgets, electronics. And following the order of the Lagos State government, they are locked. Some of the shop owners, at least one of them that we spoke to, is not happy about this. Well, while some say it's a good idea to curtail the spread of COVID-19, they said that the government ought to do something to compensate them and keep them, before this is over.
They asked us to close the shop, but they are not giving us any fund, like money now. Some people now, it's every time they come out now, they do make money, they can eat from now. And now they're asking us to close the shop 1 week. Now, what will we be eating?
The government order to shut down is good because we need to really clear up the streets of people for their own personal safety.
So there you have it. They're also asking that the government will look into how to buffer some of the consequences. One of them is just sustenance until this is all over. Ini John Mekwa reporting for Channels Television News.
So essentially, in it, they're reporting a lot of mixed feelings there with some of the residents in Lagos. But let's take you to Bauchi State, where health authorities, they're giving more information now while confirming the additional case of COVID-19 in the state. The second case, a 62-year-old male who is a close friend of the governor, Bala Mohammed. The Commissioner of Health, Dr. Aliyu Maigoro, says out of 48 samples taken, 2 have been confirmed positive, 37 returned negative, while results of 9 samples are still pending. Contact tracing from the second case has commenced. The Bauchi State now has 2 confirmed cases, the first one being the governor himself.
So we have taken 48 samples of high-risk patients to Abuja. That is from day 1 up to this time when the first index case was confirmed. And out of this result, as of today, we have 2 confirmed cases of COVID-19 in Bauchi State. And out of those samples taken, 37 returned negative. And we are awaiting or pending of 9 results. And we didn't record any death so far. And in addition to that, even the index cases, they are not displaying any sign or symptoms as at this time of reporting. And the first index case is recovering and is doing extremely very healthy. And up to this time, there is no any sign or symptoms suggestive of COVID-19 except the confirmatory result. The second case is also been isolated, and he has already started receiving management as well as any other supportive case management.
In Kano, there is no confirmed case of COVID-19, but the state government is taking several precautionary measures against curtailing, that is, against the spread. Here's our correspondent, Nanchin Vincent, with more.
Coronavirus disease has continued to increase in the number of suspected cases and confirmed cases across the country. But this has not been the case, as Kano State has not had any suspected or confirmed case here in the state. However, Kano State government has remained top-notch in ensuring that precautionary measures have been put in place. We have the schools in Kano all shut down. Civil servants have also been told to stay at home. There was a meeting yesterday with the Kano State government where religious leaders were urged to ensure that their worshippers take precautionary measures as well by sanitizing their hands and keeping up with the hygiene to avoid being infected by the COVID-19. And there was also the ban on interstate movement. No more coming in to Kano State from neighboring states. All routes into Kano State will be banned and be halted from the 27th of March, and that is tomorrow. From the midnight of tomorrow, no more movement into Kano State, including domestic flights at the Aminu Kano International Airport. However, as you can see behind me, I'm right here at the Kano major market. This is the Sabongari main market. And people are just going about their normal businesses. There is the directive that there should be 1 meter social distancing, but it doesn't seem to be the case right here. I would be speaking with some people if they do understand the severity of the times that we are in.
Well, that's Nanchin Vincent there from Kano. Well, Niger State is yet to record any case of COVID-19, but the government is not taking any chances. It has suspended Friday Jumat prayer and all congregational and weekly prayers in all mosques across the state. Sunday services at all churches in the state have also been suspended. The secretary to the state government, Ahmed Matani, explains that the suspension is part of the state government's precautionary measures. The state government has already ordered the closure of public, private schools as well as tertiary institutions for 30 days with the suspension of all public gatherings across the state. Well, still to come on our special coverage of COVID-19, we have more from our correspondents here in Nigeria. We'll also be bringing you the latest globally. Please join us again. We go over to Edo State, where the Deputy Governor, Philip Shaibu, has been speaking on the COVID-19 pandemic. He's asked citizens of the state to stay at home to avoid a spread.
All shops and markets, especially those that are not selling food, should remain locked. We want to reiterate that. And by tomorrow, we have asked the law enforcement agency to enforce this government directive of all of us sitting down at home and also not moving around. And we also discovered that most of the civil servants and most of those workers that we have asked to stay at home, they are moving about. That was not the intention. The intention is for you to stay at home. And staying at home will help us to reduce the spread of coronavirus. We are presently contact tracing 111. And you staying at home will help us to reduce this number. Transport companies have been warned and advised that some of these vehicles that go for inter-country transport and are coming to Benin, we must have the manifest of these passengers so that we will help to check if they need to go on self-isolation, and we need to screen them. Environmental sanitation is going on, has started today across the state. And you can see the truck, they will be going through all the streets in Edo State to fumigate all our streets and public places.
Let's take a closer look at the level of awareness in Nigeria and also measures to curb the spread. Joining us in the studio is Dr. Oluwatoni Adeyemi. She's a PRO, Association of Public Health Physicians of Nigeria. Thank you for joining us at this time.
Thank you for having me.
All right. The minister yesterday, when he addressed with the latest on COVID-19 in Nigeria, said that the strategy is to strive for the best case scenario and indeed prepare for the worst case. You think we're prepared for the worst case?
Well, we're working towards preparing for the worst. That's actually wise counsel, because we are not going to treat this like, we need to treat it's a pandemic, and a pandemic is something that is of an emergency nature. So you need to be prepared, even if your measures might look like you're being over-prepared, especially for some states that might think that they don't have a case yet. It's actually the right way to go. And I'm happy from the news you read recently, a lot of states, even states like Kano that don't have any case yet, they've actually gone on like a lockdown to prevent importing cases from other states. So I think we should actually prepare for the worst. Preparing for the worst, what does it entail? It entails ensuring that people, first of all, this is a collective responsibility. It's not just the government's responsibility now. So individuals have to take responsibility. Health authorities, government agencies have given out regulations. Let's abide by these regulations. Let's stay at home. Staying at home is going to do a whole lot. It's going to take us from one level to the other. We're still on, I don't know how to stage it, so we're still having like double-digit cases. But in other countries, we've seen a sharp rise in their cases in just a few days. People that didn't take the lockdown very serious. So that's very, very important. The government on its own part would ensure that we have more isolation wards ready, such that if you have a large upsurge in the number of cases, there are places where they can take them to. And the private sector is already partnering with them. We are aware that at Oniko Stadium, they are setting up an isolation unit. We need to build capacity. We need to train and retrain even our health workers to ensure that they are ready to deal with this crowd, because we are anticipating it. We're not going to live in oblivion and say that, okay, no, we have just 51 cases right now and it's not going to rise. It's going to rise, and that's the absolute truth.
Well, you know,
so we need to prepare for the worst.
Social distancing would also be a huge problem. We've heard from some of the people there saying it's difficult staying at home when their shops are closed and they need to make money, they need to feed, perhaps they need more bailout from the government, essentially. But when we look at what the World Health Organization has said about Africa before it got into the continent, that is our healthcare system infrastructure. Do you think our government is learning to ensure that we have fortified healthcare infrastructure across the country?
Well, I think what's going on currently is actually an eye-opener to a lot of people, even our political leaders and people that make decisions on our behalf. So it's actually an eye-opener, and people have realized the need for more investment in the health sector. Social distancing, as you mentioned, is a bit difficult, as you said, because of the peculiarities of our nation as Nigeria. We have different problems. There's a high level of poverty, educational level. Awareness is poor out there. We need involvement of our community leaders, residents association, community development association. These are the people that will help cascade down this information. Not everybody has access to TV or radio. They don't even have lights or electricity to even watch and know what's happening globally. That's why they will tell you that, okay, COVID-19 is not true or is only affecting the high and mighty, which is not true. So we need education, awareness. We need everybody to get involved as much as possible so that this information is channeled down to everybody that needs to hear it. We saw reports of people at bus stops. Bus stops are still busy. Ikorodu, as at yesterday night, had a lot of people at the bus stop. So people are not taking the social distance serious, and it's actually the only key. That's the major strategy we have right now to actually break the cycle of transmission and flatten the epidemic curve. That's what we have right now to work with.
Let's see. So interesting what other countries are doing. We still have our guest with us, but let's take you to Jigawa State. Our correspondent there, Sadiq Ilyasu, is reporting on the suspected cases in the state and what the government measures and also the level of compliance.
Jigawa has not recorded a single confirmed case, but some days ago, 6 days to be precise, a family of 3 in Babura local government who came back from Saudi Arabia and were showing symptoms which are like that of the COVID-19 virus were all tested negative. But despite the zero number of people affected in the state, the government takes drastic actions in order to prevent its citizens. The most recent is closing its borders with Bauchi, Kaduna, and Edo State. This is coming after Bauchi State records 2 cases and Kano State shutting its borders with Jigawa, which is the only route from Bauchi to Kano. The state government, however, has also taken more measures, and these include asking civil servants to stay at home for 2 weeks, except for the essential service providers. The Executive Council meetings are also suspended. State Assembly plenary sessions are also suspended. Schools are asked to shut down. Viewing centers and other joints are also asked to be closed. Gatherings of more than 20 people are banned. Now, yesterday, the task force constituted by the state governor, Badr Abubakar, under the leadership of the Commissioner of Health, met with motor parks unions and religious leaders. Later, the commissioner briefed journalists on the outcome of the meetings. The commissioner says, since no case is recorded in the state, people would be allowed to go to mosques and churches. While the government is taking all necessary steps to ensure the safety of its people, the hope is that the people understand the dangers of the virus and comply with the directives and also practice personal hygiene. Back to you in Lagos.
Thank you. Let's take you to Kaduna State, the steps of the government and the level of compliance. Here's our correspondent, Chimezie Inyocha.
Kaduna State has moved into a lockdown mode as all socioeconomic activities have been shut down. City center roads are deserted, while offices, shops, and schools are shut down due to the curfew imposed across the state by the governor. The government moved from advice to actual enforcement of restrictions so that everyone will understand the collective danger COVID-19 portends. According to the authorities, prevention is the only logical thing to do at this critical moment. They say it is better to impose restrictions and save lives than to be complacent and bury victims. Chimezie Enyocha, Channels Television News.
Globally, we hear South Africa has reported its first deaths as lockdown begins, announcing those deaths from the coronavirus infection. They're said to have passed the 1,000 mark. And both deaths took place in hospitals in the southern province of Western Cape. The U.S. overtaken China and Italy in its number of cases. Latest figures collated by Johns Hopkins University. In China, we hear they have announced a temporary ban on all foreign visitors. The country is also limiting Chinese and foreign airlines to 1 flight per week. And Xi and also President Trump holding telephone conversation on the COVID-19 pandemic. We hear Vietnam has become the latest country to ban large public gatherings. It announced on Friday that indoor gatherings of more than 20 people and outdoors of 10 people or more would be banned. Let's also take you. The World Health Organization's website is live with updates on the pandemic each moment, depending on what part of the world you are. It's keeping you updated with regards to the number of cases, the number of deaths, and the recovery efforts. The World Health maintains risk assessment of the pandemic as a level of very high. You can take a closer look at some of the numbers in real time. And finally, with our guest, just before we go, Dr. Adeyemi, briefly, fact and fiction, COVID-19 and smoking, is there a relation?
There's no direct relation, but there's an indirect relation because smoking affects the lungs. So a smoker would have already had long-term damage to the lungs. So he is more predisposed to coming down with the complications that come as a result of COVID-19.
All right. And I'm sure mosquitoes and flies don't carry the pandemic.
No, they don't.
I'd like to thank you, Dr.
Oluwatoyin
Adeyemi Piaro, Association of Public Health Physicians, Nigeria. Thank you for joining us.
Thank you for having me.
Well, that's our COVID-19 special edition on the program. Thank you for watching. It's another 30 minutes update on the pandemic across the world and in Nigeria. It comes up later at 6 p.m. While you're social distancing, we'd like to hear from you. Tweet at us at Channels TV. Bye for now.